Hello, California Oral Health Summit. I am Jennifer Webster Cyriaque, Deputy Director of the National Institute of Dental and Craniofacial Research. Thank you to Dr. Jay Kumar and partners for inviting NIDCR to participate in this timely summit. Your 10-year California Oral Health Plan really serves as a model and an inspiration for other states in the union. The fact that California is the largest state in the union really makes the achievement even more impressive. You've done the important preliminary work and have laid a critical foundation by really optimizing your state-based oral health surveillance program and by working to understand what are the key barriers to effective communication and understanding the importance of dental providers serving as educators to improve oral health literacy. Now, a bit about NIDCR. We are part of the National Institutes of Health and use our congressionally appropriated budget of just over $500 million to support basic, clinical, and translational research on dental, oral, and craniofacial health. That not only happens here at the NIH campus, but across the U.S. and around the globe. And our mission is to translate these research findings into prevention, into early detection, into treatment strategies that improve overall health for all individuals and all communities. We are increasingly focused on understanding and really rectifying the vast inequities in oral health that occur across our country. I congratulate you for noting these inequities and capturing them in your 10-year plan. As you are aware, NIDCR documented many of the same disparities in the Oral Health in America Advances and Challenges report, which was published just about a year and a half ago. We know that social determinants of health, the physical environment, health behaviors, and healthcare all lend to the development of oral health disparities. We know that oral health disparities are a challenge across childhood, across the lifespan, from childhood with 3 times higher caries levels in American Indian Alaska Native children compared to non-Hispanic white children, in working adults with higher levels of periodontal disease in Black and Hispanic populations, and in older adults with more than 70% of people over 65 not having any dental insurance during the time when they have so much systemic illness. We had a recent think tank, and what did we learn? Our lessons learned tell us that in our historic studies, they've not been longitudinal. Most of them have been short-term interventions, kind of focused on early childhood caries. We learned that the hard-to-reach populations remained underrepresented and underserved. We got to do this differently, and we've learned that our research in the community has really been limited. We haven't done a great deal of community-based participatory research. Let me share with you what our efforts are to combat and mitigate these inequities. We need to work to build a workforce that really reflects the diversity of our nation. We need to build community-driven research efforts. We've got to build networks and repositories that really facilitate study coordination. We've got to understand the risk factors in the context of the whole person. We've got to look at whole person health. And we've got to look at upstream social and commercial determinants. We've got to advance the science of dissemination, of communication, and of implementation. And we've got to do the research to determine how best to implement prevention, navigation, and care coordination. We have to facilitate research that helps us understand how to surmount those upstream barriers, not just to understand them, and to also consider the myriad of social challenges together with systemic comorbidities and illnesses of those who are also likely suffering from oral health disparities. We encourage you to apply for research mechanisms that will help us to answer these important questions. In sum, I congratulate you and your many colleagues for your vision and dedication to improving the oral health of all Californians. Have a wonderful and great summit. Thank you.